Next, our first muscle dissection of the cat is going to deal with all of these medial muscles of the cat's thigh. Now, keep in mind, this is medial, because if this is human, you wouldn't normally have your legs splayed out. It would be, tighter in. But this is splayed out, and we have the medial thigh here. So just to get you oriented, this is going to be the anterior side of the thigh. This is medial, and this down here is posterior, the back of the thigh. Okay? So the major muscle groups that you'll find on you as well as a cat up front here are going to be on the anterior side, the quadriceps, the quads. And then on the medial side, you'll have the adductor groups. And then back here, you'll have the hamstring group. So quads are going to be used for this motion, okay, flexing the thigh. The adductors adduct the thigh, meaning bringing it in like so. And then the hamstring group on the posterior thigh is going to pull the leg like so. Okay? Now, here's the biggest problem. In a cat, there are these two major muscles which have nothing to do with those. This right here is the sartorius, this is the gracilis, and they, being larger in a cat than in a human, cover up the quads, the adductors, and the hamstring group. The first thing I'm going to want to do is isolate these from each other, this anterior compartment from this medial posterior compartment. And you'll see this femoral vein injected with blue latex and a femoral artery underneath it that sort of define that line. Now, if I slide a pair of forceps underneath it, you'll see there's a little bit of areolar tissue, and I can rip through that, pretty well. This is going to be your defining line. Forceps, and just start tugging on things. And this is going to be just one of your major techniques is just to move muscle groups, move areas. And you'll notice that if I'm tugging on this muscle area here, this area moves, but this does not. And that'll show you that the defining line is right there. Again, you can see the sartorius muscle moving, even if you can't see the muscle tissue. And you can see that this area is not. There's your defining line. And we're going to try to slide in between them and isolate between. Okay? I'm just going to cut through the areolar tissue as best I can. And now we have the edge of the sartorius isolated. Okay. So what I did is I just ripped the fascia, which is a connective tissue wrapping around the quadriceps group, and isolated the tensor fasciolata, which is this muscle right here. And you can imagine from where it is, the origin to insertion, when it pulls on its connective tissue insertion right here, it pulls the leg off to the side, abducting. Okay, so once this is out of the way, and if you need to, you can even clip the connective tissue in front of it, this IT band or fasciolata, in front of it a little bit, not hugely, just a tiny bit, to allow it to reflect out of the way a little bit better. But now we have, most importantly, the quadriceps group, which is this huge chunk of muscle here. Now the first thing you need to do is rip the fascia that covers it again. There's quite a bit of this fascia here. I'm going to try to just rip it with a pair of sharp forceps or scissors. There it goes. So this muscle right here, we can actually bisect. And I'll show you a different way of bisecting a muscle. So what you can do is actually take a pair of scissors, for example, like this one, and slide them underneath the muscle and lever it up. You're going to use the scissors as a bit of an operating table. And what I'll do is I'll take the scalpel and cut through the rectus femoris. Now the reason I'm using a scalpel for this as opposed to scissors is it's such a thick muscle, scissors wouldn't work so well. So, right in the middle of it, halfway between the origin and the insertion, cut on through, and there we go. Rectus femoris bisected, and now we can reflect it out of the way. And now we can summarize the four muscles of the quadriceps. The rectus femoris, the strongest of the four, and then the three muscles that are called the vastus muscles. And they're named by their location. Vastus medialis, vastus intermedius, vastus lateralis. Do not try to separate them from each other. They are all fused together, so you can just think of them as the 3 vastus muscles plus the rectus femoris. That is the entirety of the anterior thigh that you need to know.